Hello students, this is an audio lecture materials prepared for first aid course or 1 credit hour course by Pharma College Awasa campus for the first year pharmacy students as an additional reading or an additional learning material or support to the students during this COVID-19 pandemic. And I am Mangiste Bakala. The course intended to cover today the introduction or part of the first aid, which have 4 subtopics. First, the definition of first aid, and also the second part covers or discussed or deal with reason why first aid is given, and the third part, appreciation the value of the first aid, and the fourth part, identifying the general direction for giving first aid. Okay, in defining first aid could be defined as the care given to a person who has been injured or suddenly taken ill. This may include home care if medical assistance is not available or delayed. Usually, first aid is given away from medical center or any place and given usually by a lay person or trained first aider or lay person or paramedical person. The definition of first aid also contains the use of selected words of encouragement in reference to the victim, evidence of willingness to help, and promotion of confidence by demonstration of competence. So showing our competence and use of selected word of encouragement or reassurance is also a part of the first aid. It is a part of first aid, and also it's also known to help the victim. The reason for first aid giving can be in 3 areas, or the objective of giving first aid, or the aim or the purpose of first aid could be regarded in 3 areas: preserving life, preventing worsening of the problem, and promoting healing and recovery. Under each sort of techniques and approach will be explained in further lectures. The value of first aid in this area of high population growth to be valuable, as well as increased trend of accidents, particularly in our country or in our setup, the tremendous increment of road traffic accidents, and as well as increased use of technological product like electrical appliance, machineries are just expected to induce problem and at workplace, at living area, or at home area, and peoples are also considered to be at risk in playing area. So in this era of such conditions, the value of first aid or the value of to be certified first aider is high. So there is a growing demand of first aid training for personal use, and from the demand of certified first aiders as a part of industrial and commercial establishments. So it is valuable, this commercial establishment or personal interest, there is a high personal interest in order to be certified or trained first aider. So in general, first aid aims to help others, preparation for knowing what to do during disaster, as well as to help yourself or oneself. The first aider can help himself even. The general direction to give first aid. A number of steps we should follow in order to give a first aid, or during the while we are giving first aid. These are in the management of the causality. We have to follow assessment of the situation, the first and the most immediate task expected from the first aider, and upon assessment of the situation, the first aider is expected to identify the problem. Upon identifying the problem, and identifying or diagnosing the problem or identifying the diagnosis, he is expected to give an immediate and adequate treatment to the causality. He has to bear in mind that there will be sometimes more than one injury to a single causality. And upon the type of the injury, when there are multiple injuries, it should be prioritized upon their urgency, the urgency of each injury. And after these steps, the causalities should be transported for further observation and treatment and assistance if needed. Otherwise, even he has to be sent off to his home or to his friends or families. So this also this also included in the actual management procedure of the causality. And upon sending to the better facility or to better treatment area, the first aider is expected to write a simple note about the situation and the treatment and conditions to anyone who's interested. And also, finally, it is good also to assume prevent cross-infection other than the actual damage or occurred due to the accident. There will be cross-contamination and infections of the causality's body. So this also needs an attention. In assessing the situation, the first aider is expected to be calm and take a charge and be confident. First, he has to be calm. He should not be frustrated or disturbed due to the accident or due to what he is seeing or what he is going to see. Otherwise, he cannot help others if he is not confident and take responsibility. And upon approaching the victim of the causality, he is expected to talk with and listen the causality. And through this, he can specify the level of consciousness of the causality or the level of damage occurred to the causality. And always, the causality should be sure about the safety of himself and as well as the causality. If it is not safe or if the environment is not safe and guaranteed to give a first aid, he should not be involved in giving first aid. As well as it is also good to know about the country's law about giving first aid for a person who you are not knowing him before, who is strange to you, who you met him on the way. So it is good to know about the country's law and the area's culture, approaching and giving treatment for a stranger or by a stranger. And it's also, upon assessment, it is good to call for others to help you also, to be with you, because it helps or promotes or it strengthens or contributes for further support of the patient. In problem identification or diagnosing, the initial part will be asking about the history of the accident or the incident. Because from the history you can learn what type of part of the body to be examined, what type of attention or to what part and to be considered and further understand or in detail to understand the condition of the causality. So it is good to ask history. You have to ask history or take history of the accident or the incidents. In taking history, how the accident happened or illness began can be obtained even for the causality himself if he is unconscious and able to talk. Otherwise, bystanders or any other witness who was there during the time of the incident or the accident. So points to be considered during history taking may include history of any illness, even for unconscious causality. For unconscious causality, if he has an history of epilepsy, or if he was a diabetic mellitus patient or a DM patient, and any history of ingested material, type of food even, or drug he take, or alcohol's consumptions, can give you a clue what to do and what to imagine. And further examining the patient, it is good also to listen the sensation and feeling of the patient if he is able to explain. So you have to consider what he is feeling after the accident, these symptoms. He may say that he feel pain, or he feel cold, or he may feel numbness, he may say. Others, the first aider should observe the signs, important signs. These are the variation from the normal structure, from the normality ascertained by you or by the first aider. For example, pallor of the inner surface of the eyelid, for indicating severe bleeding or continued bleeding, blueness or cyanosis of the face, lips, fingers, and toes, or deformity of the long bones, indicating the fracture, like that, and also others like poisoning or medications, alcoholic smells, bottles, and other containers besides the victim. These can be signs. These can be symbols of what has been done before or what has happened before. In identifying the level of consciousness, it is good to know the 4 levels of consciousness. The first level of consciousness is a fully conscious. The conscious causality can simply or easily can talk and communicate with you or with any other persons at the place. And there will be drowsiness. Drowsiness is, the person can be unconscious but easily aroused. Easily you can arouse him, you can wake up him, but immediately he will return back to his unconsciousness. And the third type of consciousness is stupor. Stupor, the causality may not arouse simply, but he will be aroused or awakened with difficulty, with painful stimuli like a pinprick, inserting needles or pins to his body, and he can be awakened. And the fourth part of consciousness is coma. The comatose patient cannot be awakened by any stimuli, including those painful stimuli, cannot awaken him. So in general, you have to make full use of your sense to obtain maximum information. You have to look, smell, listen, and touch in all sense of in all your senses. And as action upon identification of the problem, you are expected to take action. If the cause of the condition is still active, you have to remove. Upon there, while you are just observing your patient, there may be a lodging on his leg or some physical structure over the patient. So you have to remove it as an assistance or while starting intervening in supporting. You have to also move if there is a danger of fire for that patient, or if there is further injury to that to leave him in that particular place. You may expect further injuries, so you have to move. Unnecessarily, you should not remove or you should not move the patient, but if necessary, if there is a fire, if it's a water, or if it's a poisonous fumes, or if there is a road traffic accident further, if he's in the center of the road, and if vehicles cannot notice the laying of that person. So at this type of condition, you have to remove the patient to the safety. In general, essential point based on the objective or the aim of first aid should be explained here. In sustaining life or preserving life, we need to learn about emergency resuscitation techniques, and we need to learn about controlling bleeding and shock. We need to know this, and also in preventing worsening of the problem or complication, we need to know about covering of wounds, and we need to know time techniques, making comfortable the patient, handle gently and carefully at all times. And it's good also to move as little as possible, because moving can cause further damage to the structures or to the bodies of the causality. In promoting healing and recovery, it's good to place the causality in correct and comfortable positions, and it's also good to continue to reassure him, and to give further treatment, including pain relievers and others, after the immediate intervention, you further follow up him, you further reassure him, you further, protect him from the cold like that. It's good to convey the causality without delay to home or to hospital. Transporting the victim is very essential. In serious case, it is good to inform to health personnel, and also, as we have mentioned earlier, it's good to have a brief report, a written report of what was the problem and what we did and where he was found, like that, when you send him to the further treatment area. It is good also to think about his relatives or friends and send them a message tactfully. And they may follow up and contribute for sooner recovery of the victim, this should be based on tactfully, or you have to keep the psychology of his relatives or friends, and also you have to be sure about police situations, whether the police is handling this issue, and other authorities may follow up this issue like that. Based on that, this part also could be a part of your aid, or as a first aid, or as a first aider. And this will bring the end of today's presentation, and we see each other with other sessions and presentations. Thank you.